Jack it up.
Hello guys, welcome back to this video. In this video we'll be talking about urine formation. So what is urine formation? How the process of urine formation is going to be formed, how the urine is going to be formed within the body is what we'll be looking at within this video. Now we know that the primary organs for urine formation is the kidney, and the functional units of the kidney is the nephron. So this is the total structure of the nephron. Now, the kidney comprises of 2 major nephrons. Only 1 major nephron is sufficient to carry on the total process of urine formation. So, within the urine formation, there are 3 major processes that actually occur. One is the glomerular filtration, the tubular reabsorption, and tubular secretion. Now, the blood is going to enter through the afferent tubule within the glomerulus. Through the afferent tubule within the glomerulus, once the blood is going to enter through this, the filtrates after the glomerular, we call it the glomerular filtration. So, we absorb 120 milliliter per minute. That ends up in 180 liter a day. Now, that is going to go all the way through this tube and come as a pee. Means that when we absorb the 180 liter, we go all the way through this tube, the nephron, and come as a pee. Means that we die quickly. So here, so many things have to occur. That is what? Reabsorption. So everything that we have reabsorbed, or everything that comes through the glomerular filtrates, we're going to be 99% of it is going to be reabsorbed. So if 99% of 180 is going to be reabsorbed, means that we pee 1.8 per day. Now, within the glomerular filtration, after the glomerular filtrates, when you go all the way through this tube and come out as a pee, now we say here, what is going to be reabsorbed here? 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 What is going to be reabsorbed within the postport converted tubule? And what is going to be reabsorbed in the luxor handing? What is going to be reabsorbed within the distal converted tubule? And what is going to be reabsorbed within the collecting ducts? Is what we are going to be looking at within the entire process. So, for example, 60% of everything that we absorb is going to be reabsorbed within the postport converted tubule. 15% is going to be reabsorbed in the luxor handing. Then we talk about 15% will also be reabsorbed in the distal converted tubule, and 5% is going to be reabsorbed within the collecting ducts. So if we go through this process, means that we will pee 1.8 milliliter per day. Now, if we talk about reabsorption, think of it that is outside the body. It's not absorption. Absorption takes place within the gap, where things are within the gap, in the gastrointestinal tract, and then it is being what? Absorbed within the body. But now, when we talk about reabsorption, think of it that is outside the body. So they are within the tube, they are going back within the capillaries. They are going back within the bloodstream. They are going back within the biological system. So, what is going to be reabsorbed here? 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 Reabsorbed here. And what is going to be reabsorbed here? and also what is also going to be reabsorbed within those various quadrants. So this is the possible converted tubule, the firm descending loops of Hamden, the firm ascending loop of Hamden, the dextral converted tubule, and the collecting ducts. And now, so what are those things that are going to be reabsorbed at these various points? Now, we're going to say ions. All these ions we are going to put here. Anytime we measure ions, means that we are talking about all of these ions. We talk about sodium ions. We talk about chloride ions. We talk about calcium ions. We talk about magnesium ions. So when we speak of ions, these are the ions that are going to be reabsorbed within the possible converted tubule. When we measure ions again, means that we are talking about these ions here. So in addition to that, we say bicarbonate. Bicarbonate is an ion, but for a specific reason, we are putting it here. Bicarbonates, and then we have amino acid, and then we have water, and then we have glucose, we have urea, we have. So one major important thing is it's within the possible converted tubule that glucose is reabsorbed 100%. So glucose should be reabsorbed within the possible converted tubule 100% because glucose have high osmolarity. Glucose have high pulling force. So if glucose is not reabsorbed within the possible converted tubule, it is going all the way through the tubes and come out as sugar. That's why people with diabetes, sugar patient, always pee more because of the high osmolarity that glucose have. So what is also going to be reabsorbed within the firm descending loops of Hamden? Here we only have one thing, that is what? Water. So water is going to be reabsorbed within the firm ascending loops of Hamden. So the longer the firm ascending loop of Hamden, the more the reabsorptions of water take place. So it also helps in dehydration. So if you have long loops of Hamden, firm ascending loop of Hamden means that it will help in the process of dehydration. So what is going to be reabsorbed in the firm ascending loops of Hamden? We have ions, these ions, and we have bicarbonate. We have bicarbonate. So what is going to be reabsorbed within the possible converted tubule? We have ions. We have ions. We have water. And we have bicarbonates. So what is going to be reabsorbed within the collecting ducts? Within the collecting ducts, we have chloride ions. We have calcium ions. We have magnesium ions. We have chloride. We have calcium ion. We have chloride ion, and we have water. We have bicarbonates. So these are the things that are going to be reabsorbed within. These are the substances that are going to be reabsorbed. So these are all of the process. So this is the process of reabsorption. So we're talking about from reabsorption, we look at what? Secretion. Secretion is, when we talk about secretion, means that we're taking up air that is within the body and it's going to be thrown back within the nephron. So what is going to be thrown back within the nephron? So within the nephron, what are those substances that are going to be thrown back within the nephron? So within the nephron here we get uric acid, and then we have urea, we have some drugs, we have creatinines, So these are substances that are going to be thrown back within the bloodstream. These are substances that are going to be thrown back within the prostoconverted tubule. We have uric acid that's going to be thrown back within the nephron. We have urea, we have some drugs, we have creatinines. So within the film, the same thing looks of handing. What is going to be thrown back is only one thing, that is urea. Urea is the only thing that is going to be thrown back here. So within the film ascending loops of Henle, nothing is going to be thrown back. Within the distal-converted tubule, nothing is going to be thrown back. And within the collecting ducts, what is going to be thrown back? We have some drugs. We have urea. We have water. Ammonia. We have ammonia. So these are the substances that are going to be thrown back within the nephron. So this is the total process of urine formation. So in this video, we've been talking about urine formations, where we talk about the glomerular filtrations, where we talk about tubular reabsorptions, we talk about tubular secretion, and in our next video, we will be talking about urine analysis. So after all of these processes occur within the body, what do we expect of the urine? Like, where is the specific gravity of the urine? Where is the color of the urine? If you find a ketone within the urine, where is the indications? When blood is in the urine, where is the indications? So in our next video, we'll be looking at what? Urine analysis. Thank you so much for watching. If you like the video, please share, subscribe to our videos to be notified for our next video. Just hit the notification bell to be notified. Thank you. We see you in our next video.